Yeah, welcome to RC Medical Diagnostic Laboratory Service. I hope you enjoyed my video on pelvic inflammatory disease. I hope you learned something. Did you share my video? Did you comment? Did you like? If you did not share, you did not like my video, and you did not comment on my video, please do that. I'm begging you, please comment on my video, like, share my video. Thank you. Today we are going to discuss stomach ulcer. Most of us have heard about ulcer, but today I'm going to give detailed explanation, the causes, signs and symptoms, diagnosis and treatment of ulcer. Stomach ulcer or gastric ulcer are painful sores in the stomach lining. So if you look at the video, you are going to see a picture of ulcer, and that is what ulcer look like. So in other words, we can say ulcer is a wound in the stomach lining. Number one is heartburn or pain in the middle of your abdomen, in the middle of your abdomen, between your chest and belly button. So when you are having heartburn or pain along this line, just know that you have developed ulcer. Sometimes when you eat food, it will seem the food is not going down. It is still hanging on your throat. This is a symptom of ulcer. Your mouth tastes bitter. So this bitterness in your mouth is caused by acid reflux from your stomach to your mouth. People mistook it to malaria. They will associate it with malaria. No, it is not malaria. It is an acid reflux from your stomach to your mouth. So that's what causes it. That is a sign of ulcer. Symptom of ulcer is feeling easily full. When you eat small, you feel that your stomach is bulging out. So it is a symptom of ulcer. Causes of ulcer. Number one, an infection with a bacterium called Helicobacter pylori. This bacteria causes ulcer in the stomach. Two, long-term use of non-steroidal anti-inflammatory drugs such as aspirin, ibuprofen, or naproxen. So when you use these drugs for a very long time, you might develop ulcer. So number three, increased body production of acid. So when there is a high increase in production of acid in the body, it causes ulcer. So these are the causes of ulcer. Treatment of ulcer is based on identifying the actual cause of the ulcer. Is the ulcer caused by an infection with Helicobacter pylori, or the ulcer caused by increase in acid production in the body? Is it caused by long-term use of non-steroidal anti-inflammatory drugs such as aspirin, ibuprofen, or naproxen? There's other anti-inflammatory drugs. Treatment is simple. First treatment, if you have ulcer, you don't have to take this drug as it can aggravate the ulcer. It's caused by Helicobacter pylori. Then you use antibiotics. If the ulcer is caused by increase in acid production in your body, you use antacid. There's a lot of antacid you can purchase over the counter. So you use antacid in the treatment. There is other diet which also helps in treatment of ulcer. Avoid eating spicy and fried foods. Spicy foods and fried foods is not good for ulcer. Cabbage is good. You can eat cabbage. It helps in healing ulcer. Yogurt is good. It helps in healing ulcer. Honey is good. It helps in healing ulcer. Complication of stomach ulcer. This complication comes when you are not taking drug, and also you have not actually identified the actual cause of the ulcer. So number one complication is bleeding from ulcer site. So ulcer can cause bleeding, and this occurs when the person begins to vomit blood. Second complication is perforation of intestinal wall. So when there's perforation of intestinal wall, this is very dangerous and is not good. The third complication is obstruction in the digestive tract. Once you notice you have ulcer, please go for laboratory test, go for diagnosis, so that they will be able to identify the actual cause of the ulcer and then treat you properly. Number one diagnosis is occult blood test. I know we are familiar with this word, occult blood test. Number two, endoscopy. Number three, enzyme-linked immunosorbent assay for identification of H. pylori. Come to the end of this lecture. I hope you learned something, and I hope this lecture is very educative. Like, comment, and share our posts. If you are watching from YouTube, please subscribe and also share our posts. Thank you for watching.